The second thing you might think about, and the second cause of patients that do have a cause for their hypertension, is an endocrine disease, an endocrine lesion. And there are two important endocrine diseases that are complicated by hypertension. Both of them concern the adrenal glands. The adrenal glands, if you recall, are those things which sit on top of the kidney and are divided into the medulla and that of the cortex. They have an entirely separate origin and an entirely separate function. A tumor of the adrenal medulla is called the pheocromocytoma. It's a tumor of the adrenal medulla which secretes adrenaline and nonadrenaline. And that puts your blood pressure up by causing spasm of blood vessels. And patients with a pheocromocytoma, with this disease, complain of attacks in which they get palpitations and severe headaches. If you were lucky enough and took the blood pressure during an attack, you will notice that the blood pressure is high. And diastolic blood pressures of 120 and more, and systolic blood pressures of 200 and more are compatible and consistent with a pheocromocytoma during an attack. But outside an attack, it's perfectly normal. So you would think of a pheocromocytoma in any patient with hypertension, because sometimes that hypertension becomes sustained and the relationship to the attacks disappears.